Welcome to Nursing Showdown, Clinical Knowledge Battleground. I'm your host, Felicia Espinosa, and today with me, I have two last semester nursing students. This is going to be a special episode. We are featuring two nursing students for today's episode. So I'm going to have each of them introduce themselves and let us know what your name, of course, your interest in nursing, what area of nursing you plan on going into, and what really triggered your interest. Why did you want to become a nurse? All right, so let's go ahead and start with Maddie. Let us know your name, your area of nursing interest, and what triggered your interest in nursing.
Okay, well, my name is Maddie, and currently I work in the emergency department as a technician, so I do have a pretty strong interest in the ER, but I also do like the ICU. And what got me into nursing was I really got interested in medicine and like the impact on the body and how our body processes it and all like the pathophysiology. So that's one thing that got me into it.
Okay, very good, very good. And welcome to the nursing field. It's a special field, and you are going to be tested, you're going to be stretched, but I'm pretty sure you're ready for it because you're already exposed to the healthcare industry anyways, right? Very good, very good. All right, how about you, Jake? Tell us your name, your interest in nursing, and what made you want to become a nurse.
My name is Jake. I'm interested in critical care. I really enjoy the intricacies of the body and how involved and how you can be involved in helping people heal or and it's I worked in healthcare in a few different jobs, and it just feels like a natural progression to have more education and go into nursing.
Very good, very good. And thank you for joining us today. I really appreciate you guys contesting for this amazing, epic nursing competition. All right, so let me go over the rules. Specialties yet because you're students, so you're going to be getting questions from everywhere in nursing. Okay, so be ready. So whoever wins the show with the most points gets to go home with a Gemsy Scrubs. Gemsy Scrubs is a proud sponsor of Nursing Showdown, and we are super excited for their for them sponsoring the show. So whoever wins this goes on with the Gemsy Scrubs. So now before we get started into the show, I just want to go over a disclaimer for our viewers out there, and also for you guys, also considering the fact that you guys are students. Please make sure whatever information you get from this show is not used as the primary basis for your nursing practice. So make sure you are following your facility's protocols, guidelines, policies, and of course your doctor's orders. Okay? Information here can be used as a supplemental information but not primary basis for your nursing practice. Now with that said, are you ready? Let's do it. I love it. Okay. Starting with Maddie. Choose a number between 1 and 10.
9.
Question number 9. Okay. During a vaginal delivery, the fetal head retracts against the perineum, which is the turtle sign, after delivery of the head. What is the first line of nursing action? A. Apply fundal pressure to push the baby out. B. Perform McRoberts maneuver and apply suprapubic pressure. C. Begin immediate neonatal CPR. D. Wait for spontaneous resolution. You have 10 seconds. Three, 2, 1. Show your answers. What'd you write, Maddie? Is that a B? B. Okay. Jake,
Yes,
what's your
letter B.
answer?
I picked A.
A. Okay. So Maddie, this is your question. Why did you choose B?
Honestly, for me, it was process of elimination. I know that we don't need to begin immediate neonatal CPR. And then fundal pressure, I don't think that would help in this case. But honestly, we're in critical care right now, and this completely is no idea.
That's totally acceptable. All right, Jake, why did you choose A?
You know what? It's actually not a good answer. I guess it was just a last ditch effort because I wouldn't apply fundal pressure, but I was not sure. I drew a blank, so I just picked a letter. So
Okay,
this was definitely my weakest subject.
Your weak, but you would not apply fundal pressure to push the baby
Yeah.
out.
I didn't think so.
Okay, all right. Well, let's see which one of you guessed correctly. Okay, answer reveal coming right now. Your answer is
very
B.
good.
Oh
Good
wow, Maddie. Okay, very good, very good. Perform McRoberts maneuver and apply suprapubic pressure. And here is why we will do this. McRoberts maneuver, which is a sharp flexion of maternal hip, combined with suprapubic pressure, is the initial recommended approach to free the impacted anterior shoulder. Fundal pressure is contraindicated because it can worsen impaction. Call for help and prepare additional maneuvers if initial steps fail. All right, Jake, choose a number between 1 and 10.
7.
Number 7. Okay, number 7. A 62-year-old patient on hemodialysis complains of sudden chest pain and shortness of breath mid-treatment. The blood pump is stopped immediately. What is the nurse's priority action? A. Check for kinks in the bloodline. B. Clamp the venous line and return blood to the patient. C. Administer nitroglycerin. D, notify the provider immediately. You have 10 seconds. Three, two, one. Show your answers. What'd you write, Jake? I didn't.
D.
B. What'd you write, Jake?
D.
D. Okay.
Yeah.
Jake, why did you choose D?
It sounded like an extreme situation for the dialysis. I don't have a good answer for you.
Okay. All right. Maddie, why did you choose B?
So I chose B because I feel like we need to act instead of just notifying. I don't want to administer nitroglycerin because I don't know the blood pressure of the patient. So I went with B because I felt like returning blood to the patient would be a good idea.
Okay. Okay. All right. Well, let's see which one of you guessed correctly. B. Very good. Very good. All right. So here is why we would do this. This presentation suggests an air embolism. The nurse should clamp the venous line, place the patient in left Trendelenburg, and return blood if possible to prevent air entry into circulation. All right, very good. So
Makes
Maddie,
sense.
choose a number between 1 and 10.
Let's go with number 1.
Number 1, coming right up. Okay, number 1. All right. A patient returns from a percutaneous coronary intervention, also known as PCI, with a femoral sheath in place. The nurse notices oozing at the site and a drop in blood pressure from 128/76 to 92/60. What should the nurse do first? A. Reinforce dressing. B. Apply manual pressure above the site and notify the provider. C. Remove the sheet immediately. D. Increase IV fluids only. You have 10 seconds. Three, two, one. Show your answers.
Oh my God.
B.
A.
A. Okay.
Oh,
All right, Maddie, why did you choose B?
So I chose B because the oozing blood, I immediately wanted to put direct pressure, and then with removing the sheath, that would make the bleeding worse. Increasing the IV fluids only doesn't correct the problem of the bleeding, and the blood pressure is low, but the map is still somewhat stable. So I would want to address the bleeding first, and of course notify the provider.
Okay. All right. Very good. Jake, why did you choose A?
I just saw the problem with the dressing itself. I guess it was the simplest, most direct answer as far as getting to the problem.
Okay. Okay. All right. Well, let's see which one of you is correct.
Oh, of course. I quit. Yeah. Actually, I've second guessed every question.
Me, the second guessing.
Never second guess. You have
No.
NCLEX coming up. Don't second guess yourself. Apply manual pressure above the site and notify the doctor. And here is why. The drop in blood pressure and bleeding indicates possible arterial bleed. Manual pressure above the insertion site is critical to control bleeding while alerting the provider. Removing the sheet could worsen hemorrhage. Okay, very good. So Jake, choose a number between 1 and 10.
2.
Number 2. Okay. Number 2. Okay. You have a post-cabbage patient's chest tube. You have a post-cabbage patient's chest tube output at 250 ml in 1 hour of bright red drainage. What is the nurse's next step? Okay. A. Continue to monitor. B. Check the tubing for kinks. C. Notify the cardiac surgeon immediately. D. Document and reassess in 30 minutes. You have 10 seconds. Three, 2, 1. Show your answers. C. What do you choose, Jake? You're muted.
I pick C.
C. Okay.
Yeah, sorry. It's
All right.
blurry effect.
Okay. Jake, why did you choose C?
It sounds like I believe that is a lot more than normal. It's bright red, so arterial blood. Continue to monitor is too passive. Check the tubing for kinks. Is not addressing anything really. And then it just 250 ml is a lot of bright red blood post cabbage.
Okay. All right. Very good. And Maddie, why did you choose C?
So I also chose C because continuing to monitor and documenting reassess it doesn't do anything in the moment, and this is definitely possibly arterial bleed, so notifying the surgeon would be the most appropriate action.
Okay. All right. Very good. Let's see which one of you, or let's see if you're both correct. Very good. Good job.
Got one.
All right, here is why we will do this. Output greater than 150 ml after cabbage suggests active bleeding, requiring immediate surgical evaluation. Okay, simply put, right? All right. So Maddie, choose a number between 1 and 10.
Let's go with 3.
Number 3. Okay. Okay. Question number 3. A patient becomes violent in the unit and is seen arming themselves with a broken chair leg. What is the nurse's immediate priority? A. Physically tackle the patient alone to take the weapon. B. Maintain a safe distance and attempt verbal de-escalation while following emergency response procedures. C. Film the incident on your phone for evidence. D. Ignore it because the patient is clearly agitated. You have 10 seconds. Three, 2, 1. Show your answers. A. Is that B or A? B. B. Okay, so you both chose B. All right, Maddie, why did you choose B?
So I chose B because it's the only option that says to maintain a safe distance, and I'm not going to get close to a patient that's agitated with a weapon.
Okay, very good. Safety first. Jake, how about you? Why did you choose B?
Yeah, it's the least confrontational. It includes de-escalating the situation, and of course it's following emergency response procedures. Kind of reflects back to the facility protocol, which always seems like the correct action.
Okay, all right, very good. Let's see if you're both correct. Okay. And yes, you both are. Very good, very good. And here is why. Safety of patients and staff is paramount. Remove others from harm, call for help or security, and use appropriate emergency protocols. Tackling alone is dangerous. Filming is definitely not a priority and not appropriate, of course. Okay, very good. Jake, a number between 1 and 10.
Did we do 5 yet?
No.
Let's do 5.
Okay. Okay. Question number 5. A 68-year-old man presents with sudden left-sided weakness and aphasia 90 minutes after last known well. CT head shows no hemorrhage. Blood pressure on arrival is 195 over 118 millimeter mercury. What is the most appropriate immediate action? A. Give IV alteplase immediately despite blood pressure. B. Treat blood pressure with IV antihypertensive to achieve a blood pressure below or equal to 185 over 110. Then evaluate for IV alteplase. C. Send the patient home with outpatient follow-up. D. Give aspirin and observe. You have 10 seconds. Three, 2, 1. Show your answers. B. Okay, very good. All right, Jake, why did you choose B?
Well, I mean, of course, you want to signs and symptoms is signs of a clot, cerebral brain stroke, and if you don't lower the blood pressure, you could have and you treat with the alteplase, you could have a major hemorrhage issue on your hand. So I'd want at least the blood pressure to be a lot less, more controlled than what it is, and then move on to the clot buster.
Okay. All right. Very good. How about you, Maddie? Why did you choose B?
Yeah, pretty similar. I chose B because it's patient seems to be having a stroke. They're still within the window, but they have a little bit of time before they're out of the window so that you can treat the blood pressure. And B was also the most specific. So that's when it came down to between A and B, I was like, B is more specific, so probably I should pick B.
Okay. All right, very good. Now let's see if you're both correct. Yes. Very good, very good. All right, you guys are ready for NCLEX. NCLEX has nothing on y'all. All right, and here is why. IV alteplase eligibility requires blood pressure lower or equal to 185 over 110 millimeter mercury prior to treatment to reduce hemorrhagic risk. Rapid blood pressure lowering with approved IV agents such as labetalol or nicardipine, is recommended before administering Alteplase. Very good, very good. All right, Maddie, choose a number between 1 and 10.
Let's go with 4.
Number 4. Okay, question number 4. A patient who is ANO times 4 with acute mania insists they can make informed decisions and refuses hospitalization, but staff observe severe impairment in judgment and risky behavior. What is the nurse's next best step? A. Immediately discharge the patient because they say they're fine. B. Conduct a capacity assessment. If lacking capacity and posing imminent risk, follow involuntary admission procedures per law and policy. C. Ignore legal processes and forcibly detain the patient without documentation. D. Call their friends to handle it informally. You have 10 seconds. Three, 2, 1. Show your answers. B. What'd you write?
B.
B. Okay. All right. So why did you choose B, Maddie?
So I chose B because, first of all, C, ignoring legal processes is never going to be the answer. It's not a safe discharge, so I wouldn't pick A. And then B, again, is the most specific. So I would attempt to do a capacity assessment and then follow the process for most likely a 5150 hold.
Okay. All right. Very good. Jake, why did you choose B?
Very similar. B is very specific, and it follows procedures. I mean, of course, you're never going to ignore legal processes. Calling their friends to handle it is not the most responsible thing to do in that situation. And then, of course, discharging them because they say they're fine is not a good decision when there are other obvious observable risks. So I would default back to policy and procedure and process.
Very good. Let's see if you're both correct.
Okay.
Very good. All right. Conduct capacity assessment. If lacking capacity and posing imminent risk, follow involuntary admission procedures by policy and law. And here is why. Capacity must be assessed specifically. If impaired and the patient is a danger to themselves or to others, involuntary procedures may be lawful. Documentation and adherence to legal process are essential. Forcible detention without due process is inappropriate. All right.
That's
very
correct.
good.
We're not ICE.
Okay, so let's I think Jake, you're next.
We just did 4?
Yes.
Did we do 3?
Okay,
so then let's
we
do
have
7.
6, 8, and 10 left.
Let's do 6.
Okay. All right. Question number 6. A 72-year-old woman with urinary tract infection presents with fever, confusion, and a blood pressure of 82/48. Heart rate is 120, and lactate is 3.8 millimole per liter. IV access is established, but no fluids have been given yet. What is your immediate action? A. Give 30 mL per kg crystalloid bolus and start sepsis bundle. B. Wait for blood cultures, then give antibiotics only. C. Give oral fluids. D. Discharge home with oral antibiotics. You have 10 seconds. Three, two, one. Show your answers. A. And what'd you write? A. Okay. All right. So, Jake, why did you choose A?
This young lady is pretty bad shape. She's definitely showing some signs of sepsis with a hypotensive tachycardia and the lactic. Yeah, just discharging her home with oral antibiotics is not going to help her in her condition. She's kind of past that step, and then giving oral fluids isn't going to be enough. And then blood cultures alone is not enough, especially with the hypotensive blood pressure like that. So she would definitely need to have some fluids, and the sepsis bundle would include the cultures, and the antibiotics and everything else. So that seems like the most appropriate answer.
Okay, all right, very good. Maddie, why did you choose A?
Yep, I definitely would have to agree. I'm giving the 30 ml per kilogram bolus. That's the only thing that's going to treat the blood pressure and the heart rate in between these options. Oral fluids aren't enough, oral antibiotics are not enough, and then blood cultures again is part of the sepsis bundle. So obviously you want to give fluids first.
Okay. All right, very good. Let's see if you're both correct. And yes, you both are. Very good. Now let's see why we will do this. This patient meets criteria for sepsis with hypotension and elevated lactic. Initial resuscitation includes prompt IV crystalloid bolus at 30 mL per kg while initiating the sepsis bundle, and which includes blood pressure, antibiotics, and source control. Early fluids and antibiotics reduce mortality in septic shock. Very good. So we have two questions left, number 8 and 9. Maddie, which one would you want?
Let's go with number 8.
Number 8. Okay. Number 8. A patient presenting with acute neurologic deficit has a witnessed generalized tonic-clonic seizure in the ED before imaging. What is the most appropriate immediate action? A. Allow seizure to continue. Seizures are self-limited. B. Stabilize airway breathing. Terminate seizure with benzodiazepine, such as IV lorazepam, and protects the patient. C. Proceed with stroke evaluation. D. Discharge once seizure stops. You have 10 seconds. Three, two, one. Show your answers. B. Okay, very good. Why did you choose B, Maddie?
I chose B because it's been the most answers. No, just kidding. For one, it's the most.
You picked up on that, huh?
Airway, breathing, and circulation, and the answer I feel like is pretty good. Bet that it's going to be the answer. Patients having a seizure, you want to stabilize their airway first, for sure.
Okay. All right, good. How about you, Jake?
Safety first, especially airway, your ABCs. And then, of course, if treatment's an option. But yeah, always safety and protect the patient, especially in a tonic-clonic seizure, because that's going to be a high risk for hitting something or falling or injuring themselves.
Okay. All right. Very good. Let's see if you're both correct. And of course, you both are. Very good. Very good. All right. Here is why we would do this. Acute seizures require immediate termination to protect airway and oxygenation. Benzodiazepines are first-line treatment. After stabilization, continue with stroke evaluation, such as the neuroimaging and also getting some labs, as seizures may be a presentation of cortical stroke or a mimic of it. All right, very good. So now the last question, Jake, is 10. We'll go with that. Question number 10. A 66-year-old with acute ischemic stroke is within 3 hours of onset, but had a significant gastrointestinal bleed 3 days ago, requiring a transfusion. What is the most appropriate immediate action? A. Recent GI bleed is an absolute contraindication. Do not give. Do not give autoplace. I'm like, do not give what? Do not give autoplace. B. Evaluate bleeding severity and consult with the stroke team. C. Give autoplace. D. Start oral anticoagulation instead. You have 10 seconds. Three, two, one. Show your answers. B, A. Okay. So Jake, why did you choose B?
So, I mean, obviously the GI bleed, my first reaction would be to absolutely do not give. But B, had the option of consulting a stroke team. I just liked that it was bringing in outside resources to evaluate. So rather than just the hard no, at least you can get another expert professional's opinion. So that's why I went with B.
Okay, all right, very good. Maddie, why did you choose A?
I chose A because I don't remember if it's a complete contraindication, but I really want to say that any recent bleeding is a contraindication for alteplase. So definitely you're not going to do C. And then D, I think an oral anticoagulant would be contraindicated for a recent GI bleed as well, especially if it needed transfusion. So I feel like the safest answer was A.
Okay. All right. Well, let's see which one of you is correct.
Oh, no way. Awesome. That's awesome.
All right.
Cool.
Very good. Evaluate bleeding severity and consult stroke team. Recent significant bleeding increases risk and requires individualized assessment before thrombolysis. Now, here is why. Recent major bleeding is a relative and absolute consideration depending on severity and timing. Thrombolysis decisions should be individualized with stroke and hematology inputs, balancing hemorrhagic risk against neurologic benefits. Guidelines list specific exclusion criteria, and consultation is essential. Very good, very good. All right. This concludes this episode. This was great. Did you guys have a good time with it?
Yeah, it was fun. I like this.
You know,
Yeah, that was cool. That was fun.
It was fun. Yeah, pick your brain, see where you are, and it seems you guys are ready for the real world.
Awesome. Thank you.
You're ready for the real world. Okay, so the winner of this show is Maddie.
Yes, good job.
Thank you.
Yeah,
Okay.
Maddie got 90%. That's
Nice.
awesome. And of course, Jake got 80%. That's amazing. Very, very good. All right, well, congratulations to both of you. And I thank you both again for participating. And for our viewers out there, thank you guys for watching. And again, please do not use this information as your primary basis for your nursing practice. Can be used as a supplemental information, but not your primary basis. And thank you guys again for demonstrating quick and rapid, excellent patient care insights. And it shows that you are ready for NCLEX and you are ready for the real world. And again, welcome to the nursing
Thank you.
field.
Awesome.
All right,
Thank you.
until
Thank you
next
so much.
time, I'll see you all
Bye.
again. Bye-bye.
Bye.